Good afternoon, everybody. Thank you so much for taking the time out of your day to attend this information session today. My name is Sienna and I'm a registered nurse, and I've been working with the children at this school for quite a few years now. Earlier today, I diagnosed a student with conjunctivitis, and in this session, I am going to be talking about how this year group can help limit the spread. Conjunctivitis, or pink eye, is the most common eye problem for children and is highly contagious. Conjunctivitis is an inflammation of the outermost layer of the eye and the inner surface of the eyelids. Conjunctivitis occurs most commonly due to allergic reaction or infection, which is usually viral and occasionally bacterial. The infectious type of conjunctivitis are contagious, especially when caused by a virus. A child with conjunctivitis frequently rubs their infected eye. The organisms travel from the child's hands to other objects they touch, and those hands soon make their way to the eyes, and the virus transfer is complete. The same mechanism often causes the transfer of infection from one eye to another of a child. Viral conjunctivitis is very contagious, meaning that they can be passed easily from one person to another. The white part of your eyelids is called the sclera, and the inside of your eyelids are covered by a thin membrane called the conjunctiva. Tiny blood vessels in the conjunctiva can become bigger or when irritated or inflamed, making the eye appear red or pink, hence the condition being known as pink eye. Symptoms of conjunctivitis include redness in the white of the eye, eyelid swelling, itchiness in the eye, a gritty feeling or a feeling that something is trapped in your eye, and discharge that may cause crusting on your eyelashes in the morning. Most discharge is clear, but bacterial conjunctivitis causes yellow or green discharge. Behind me is the chain of infection of conjunctivitis, and I'm just going to explain what each of the chains mean. So the infectious agent is the viruses such as adenovirus, bacteria like staphylococcus and streptococcus, fungi, parasites or allergies. The reservoir is the place where the pathogen lives, such as infected humans, or in this case, our children. It could also be contaminated surfaces. The portal of exit is the way that the pathogen leaves the reservoir, typically through eye secretions, nasal discharge, tears, and respiratory droplets.
The mode of transmission refers to how the pathogen spreads. In the case of conjunctivitis, this can be through direct contact, such as touching the infected eye secretions, rubbing eyes with contaminated hands, indirect contact, sharing towels, makeup, or pillows, or through droplet transmission, such as coughing, sneezing, especially with viral conjunctivitis. The portal of entry is how the pathogen enters the new host, usually through the contact with the eyes, such as rubbing the eyes with contaminated hands or contaminated objects like contact lenses, makeup, or eye drops.
A susceptible host refers to anyone who can be infected, and in the case of conjunctivitis, this is anyone, but those who are at higher risk include children, contact lens users, people with weakened immune systems, and those that in crowded places such as schools, daycares, or working in customer service. Each link of the chain of infection plays a crucial role in the spread of disease, including conjunctivitis. Understanding the importance of each link helps preventing and controlling infections. The infectious agent is the microorganism that causes infections such as bacteria and viruses. Identifying the exact pathogen helps in choosing the right treatment, for example, antibiotics for bacterial conjunctivitis, antiviral medication for herpes-related cases. Prevention strategies like vaccination for some viral cases and hygiene practices can reduce the pathogen's transmission. The reservoir is where the pathogen lives and multiplies, for example, the infected person's eyes, nasal passages, or contaminated objects. Containing secretions by using tissues, hand washing, and avoid rubbing the eyes helps prevent the spread. Mode of transition is how the pathogen moves from one person to another. In the case of conjunctivitis, it spreads via direct contact, which is things like touching the eyes with infected hands, and indirect contact by using shared items like towels, makeup, or pillows. Preventing transmission involves hand washing, disinfecting shared items, and avoiding close contact with individuals who are infected. The portal of entry is how the pathogen enters a new host, which is commonly through the eyes. Touching eyes with contaminated hands or using infected contact lenses allows for entry. Protective measures like not sharing eye products, wearing protective eyewear in certain environments, and practicing good hygiene can block this entry point. Susceptible hosts are those who are more prone to infection, such as children, and those who use contact lenses, and those with weak immune systems. Strengthening immunity by keeping good nutrition and getting adequate sleep, avoiding exposure, and practicing good hygiene can help reduce susceptibility. Of course, controlling the spread of conjunctivitis in our school is not just on the parents. As a school, we have decided a couple things that we're going to implement in order to limit the spread when possible. We are going to be frequently washing our hands, teaching students not to touch their eyes, not sharing personal items like makeup, clothing, glasses, or eyewear. We will be doing regular cleaning of surfaces, and we will be monitoring and sending home infected students. Due to the highly contagious nature of conjunctivitis, it is essential that parents teach their kids to wash their hands well and often with warm water and soap. Children should also not be allowed to share eye drops, tissues, eye makeup, towels, pillowcases, or washcloths with others. For the parents, you must be sure that you wash your own hands very well after touching your children's infected eyes, and throw away any disposable items like gauze or cotton balls after they have been used. Towels or linens that the child has used while infected should be washed separately from other members of the family in hot water to avoid contamination. It is recommended that if your child acquires conjunctivitis, they should be kept out of school until their symptoms dissipate, as well as notifying the school of an infected child. Using a cool or warm compress on the eyes of your child may make them feel more comfortable. Clean the edges of the infected eye carefully with warm water and gauze or cotton balls, and dispose of them correctly immediately after use. This can also remove the dried discharge around your children's eyes, which may make them stick together in the morning. Pink eye is caused by a virus, usually goes away without any treatment, whereas pink eye that is caused by bacteria is treated with antibiotic eye drops or ointment. It is also very important that if you suspect your child has conjunctivitis, or if they have conjunctivitis, it should be reported to the school immediately, and you should not send them in. Keeping children at home when they are unwell is essential for limiting the spread to other children at school. Thank you so much for attending this session today. I hope that you have learned something and that we will be able to implement these changes to stop or limit the spread of conjunctivitis at our school. Thank you. Have a great night. And these are my references. Thank you.